过去当你戴假牙时，当在说话或吃东西微笑时，是可能有很丢人的情况会发生。很幸运的，因为这种看起来像真的而且生动的 Simply Natural Dentures 让这种情况再也不会发生了。它让需要牙齿的病人有很多理由可以再次微笑。 Simply Natural Dentures 依特别个体来仿效特别个性的自然微笑，还有在制造过程我们会确定它们有最好的舒适度和吻合度。现在让我们来看看 Simply Natural Dentures 更多的好处。
Robert, I know you're here for new dentures, but I need to ask you a few questions about your old ones.
Sure.
How long have you been wearing your present dentures?
About 40 years.
What would you like to change most about your dentures?
Well, my daughter brought up the point that when I smile, you can't see my teeth. And I don't know if that's the dentures or not, but I think it probably is.
Do you have any problems eating or chewing?
I have problems with like hard things like apple, or biting corn on the cob, or even chewing steak sometimes.
Are you happy with the color and shape of your teeth?
I don't know anything about shape, but in regards to color, I smoked a pipe for many, many years. And the nicotine's made the teeth darker, so I like to have them lighter if possible.
Okay, Robert, let's take some impressions. Okay, Robert, how do you like this setup trying?
Well, I really like the teeth, but they look too perfect. Is there something we can do that make them look a little more natural for my age?
Well, yes, there is, Robert. We can use a more characterized premium tooth, and we can also rotate them a little bit to make them look more natural. Okay, Robert, these are going to feel different than your other dentures. How do you like them?
These are terrific. They look so natural, they really do. And they even make me look younger, I think.
当我们要代替数颗失去的牙齿，你的牙医生可能会建议 Simply Natural Partial。这种牙科上的解决方式是比其他厂牌的看起来更自然，而且一整天下来也不会不舒适。为了要增强你的 Simply Natural Partial 舒适程度和真实感，你可以多加费用来要求加入美观的牙钩。另外，你的牙医生也可能会建议你用连结器，那会增加你移动式的假牙在日常坐骑上自然的稳定性。
Phil, as you know, we've already gone over the examination with you at a different time. What I did is I went over your entire dentition. I checked for any type of malocclusions you may have had, which you didn't. Your teeth look excellent. You've already had several sessions with our hygienist. Your gums look excellent. They're in wonderful form. Your bone is very strong. I'm very confident that whatever we put in your mouth will be able to hold real tightly for you. You don't have any teeth that are overhanging. You don't have any what we call collapsed jaws. Everything looks real good in your mouth. So now we're ready to begin the different type of options that we may be able to place in your mouth to replace those missing teeth. I need to tell you all the different options. First of all, we can do nothing at all.
No, but I'm losing my teeth. I have to do something.
Yeah, I didn't think that'd be an option for you.
Right.
Another option that I need to share with you is implants. Implants is a surgical technique where we would actually surgically place implants in your mouth, and after several months of making sure that the bone attaches tight to the implants, then we can place teeth on those implants.
Yeah, I don't think I want to go through the time element implant.
Okay. Another option is doing with a fixed bridge. However, if I did that, I would have to grind pretty significantly on two of your teeth that are very good and very strong right now.
I don't really think I want to lose any of my present teeth that I have.
As far as any tooth structure.
Grinding, right.
Grinding, okay. Then our other option, which is still an excellent option, is to make a partial, removable partial denture in your mouth. All right, that's something you would remove, you would take in and out. Would you be interested in something like that?
Yes, that's what I'm really in here for, is to improve my partial that I have.
Okay, because you're used to that already.
Right.
Okay. Philip, now that we've decided on a removable partial denture for you, what would you like to change most about your existing partial?
I'd like to have the metal hooks removed from the front of the teeth. Every time I smile, they are too obvious.
Explain the comfort and fit of your existing partial. Is there anything we can do to help that?
The thickness of the metal in the back that fits against the roof prevents me from speaking, and I'd like to have it cut away or whatever you guys do.
What we can do for you is, you mentioned to me that you want to get rid of that thickness in the back of the mouth, and also get rid of the dark hooks up here in the front. We can help. We can help you with those options. What I'd like to do today, let's go ahead and get started. And what we'll do is we're going to take some preliminary impressions, some molds of your mouth. I'll send those to the laboratory, and then they can do some preliminary treatment options or preliminary design options for us, so we can decide which option would be best in your case.
All right.
All right, Philip, I've received our models back from the laboratory. And what we're going to use here, I remember you mentioned you didn't want any clasps showing in the front, and also you wanted a thinner area on your palate so you could speak better. So what the laboratory has designed is a rotational path design, where I'm going to have to modify these teeth just a little bit, so when we place the partial in your mouth, it's going to go into the front area and then rotate into the back teeth, which will actually hold the partial in. But the front will still be locked in because of the rotational path design. After some slight modifications to your teeth, we can go ahead and begin now and take your final impressions for your partials. Receive the teeth back from the laboratory. Now, these teeth are set in wax, so you have to be real careful when I place these in your mouth. The teeth can break off easily. So what we're going to do is I'm going to take these off the model, I'm going to place them in your mouth, and I want you to see how you like them, how the way the teeth are set up, if your bite is correct, and your smile line. I just want to see how you feel with these in your mouth and the teeth in this particular position. Okay? All right. Okay, now carefully bite down. Then I want you to let me know how they feel. Run your lips across the top of them.
Feel very nice.
Okay, Phil, let's look in the mirror now, and I want you to tell me how you feel the teeth look.
Is there any way that we can get a more natural look out of the teeth, color-wise?
Yes, I think so. There's a premium tooth that we could use in your final partial that I think will brighten up the partial quite a bit and give you what you want. Okay, Philip, we've placed your new partials in the mouth. I've used pressure indication paste to check for any sore spots, and I've adjusted your bite. I've showed you how to take your partials in and out and how to maintain them. How do you like your new Simply Natural partials?
They look great, Doctor.
They
你可以看到 Phil 对最后的成品 Simply Natural Partial 非常满意。正如他所要求的，我们在这用高级的牙齿来制造出较自然的样子。如果你认为 Simply Natural Partial 对你来说是一种解决的方法，请向你牙医生询问更多的咨询。